The broadcast is now starting. All attendees are in listen-only mode.
Hello, Avant nurses. This is Jeremy Francis, one of your NCLEX instructors, coming to you from our headquarters here at Avant Healthcare in Orlando, Florida. So we're all here today. We're going to be doing a webinar, and our topic today is going to be therapeutic communication. All right, it's an excellent topic. Um, it's something that will help you not only at the bedside, but it will help you with on your NCLEX. Okay, so this is something that's both practical for test taking and for something that you can implement into your own practice every day. It will increase your relationships with your patients and can really help your outcomes with them. All right, so I'm glad that we can do this topic today. We're going to take a look at some practice questions, and I will pause the video and give you guys some times um, to answer those questions, all right, and then get back, all right. So let's start. Therapeutic communication, guys. So the thing with therapeutic communication is it's designed to help your client reach a better understanding of her condition and treatment, okay? Encouraging your client to express their feelings and discuss their ideas, okay? While showing respect and accepting their point of view, right? It's all about helping them to increase and maximize the effectiveness of their own care. Nurses need to provide patients the support and information while maintaining a level of professional distance and objectivity. It can be really hard sometimes because we get involved with our patients, but therapeutic communication is actually an objective way to really help your patients come to their own conclusions and their own decisions about their healthcare, right? With therapeutic communication, nurses often use open-ended statements and questions, repeat information, or use silence to prompt patients to work through problems on their own. We're going to talk about a lot of these tools in therapeutic communication, and we're going to look at examples and practice some questions with them. Right? So things to remember with therapeutic communication. All right, things that you should do. Acknowledge people's pain, their suffering, and their loss. Okay, both in NCLEX and in the real world, acknowledging people's situation goes a really, really long way. Okay. Um, I think our patients understand that we know that they're in pain and they're suffering and they're experiencing difficult times, but sometimes saying it really makes a difference, okay? And it gives a real opportunity for you guys to build a relationship with them, okay? So we always want to do that, both on the NCLEX and at the bedside. Remain neutral in your response to a client's words and actions. Remember, we're not there to make decisions for them, to tell them what to do, or to make them feel judged or uncomfortable about their decisions. We're there to assist them. That's all. Okay. So staying neutral is really important. Be comfortable with moments of silence. This is a question I get a lot from HCPs and testers. They want to know examples of that, and we're going to take a look at some. But sometimes you don't always have to have an answer for people. Sometimes people need you to be with them, and they need you to listen. They need someone to listen to them. And nurses, we can provide that. Okay, we got to be comfortable with not always talking, basically. So, all right. Remember that positive body language demonstrates the kind of care we want to give. Okay, almost they estimate that 85 to 90% of communication is actually body language and tone of voice and things like that. Okay, it's only about 10 to 15% of communication is actually what we say. So keep that in mind when you're talking with people. Okay, you want to be aware of your gestures and the way you're standing. Do you look like an open and approachable person, or do you look like someone who's does your body language kind of say that you're closed off to new ideas and to communicating? Because that will affect the way your patients kind of view you and approach you. All right. So it's always a good thing to clarify and restate what you think the client's saying, okay? That helps you to truly understand what it is that they are trying to convey. And also, it helps the patient understand that you're listening to them, okay? And the last one is we want to use open-ended questions with people. All right, and we're going to go over what these are in a little bit and go over some examples. But open-ended questions are basically used to lead a client into uh, more questions that can help them clarify what they're feeling and what they are thinking and what choices they want to make. Close-ended questions, which are the opposite, um, end in a yes or no answer, okay? And they don't always provide us with the maximum amount of information with which to understand the patient with. So we're going to take a look at how to use open-ended questions that lead us to other questions which can help us. Okay. All right. So with NCLEX questions, you should always eliminate before you're selecting. Okay. We talked to you guys about using testing strategies. And if you could pare down a question from four answer options to two, what you're doing is you're increasing your chance of answering that question correct. Think about it. If you've got four answer options available, well, you have a 1 in 4 chance at getting those questions correct. That's a 25% chance. Okay. However, if you're able to eliminate some wrong options and narrow it down to two answers, well, now you're picking one out of every two answer options. Okay, that gives you a 50% chance of getting the question right. That's much better. Okay, so with NCLEX questions, we always want to eliminate before we're selecting our answer, and it's the same thing with therapeutic communication questions, right? So what do we want to eliminate with therapeutic communication questions? What are what are some of the testing strategies that we can use with therapeutic communication to help us narrow it down to uh, two or three options that we can choose from? Well, let's take a look, okay? I've got six steps here for you that are pretty comprehensive. And usually by the time you go through these six steps of therapeutic communication, you've either narrowed it down to two or you've probably even got your answer already. So let's take a look. Step number one, right? Eliminate don't worry statements, all right? Don't worry statements are not reassuring to patients, okay? It's not realistic to tell them, and first of all, we don't know what they're feeling and we don't know how this is affecting them, and it's not really realistic for us to tell them not to worry. Also, it kind of gives them false assurance, all right? The truth is we don't know what's going to happen to these patients. So it's not good for us to give false assurance that everything's going to be okay and that they shouldn't worry when we don't know that. And then the third reason is because it can be a little dismissive of people's feelings, all right? When they're experiencing anxiety and worry and they're feeling that stress, telling someone not to worry kind of is a little dismissive of those feelings. So step one, if you see a don't worry statement, you always want to eliminate that, okay? It's never going to be the answer on NCLEX. Also not going to be great in real life with your patients, all right? Let's take a look at number two. You can always eliminate exploring answers. Exploring, sometimes we use a similar word called probing, okay? But what exploring and probing answers do is they pry into the life of the patient in a way that is not related to their medical condition and their treatment. Okay. It's good to get to know our patients. It is, and to build a relationship with them. But prying questions kind of go a step further than just friendliness or good relationship building. They go into that realm of asking the patient to divulge personal information that maybe they don't feel comfortable sharing. So we don't want to probe into their personal lives. We don't want to explore into their personal lives, okay? We want to maintain our therapeutic communication about focusing on their healthcare and their treatment and increasing that as much as we can, okay? So anytime you see one of these exploring answers or it feels like it's a probing answer, you know that you can get rid of that on NCLEX, okay? Step number 3, you can eliminate why questions, all right? Asking the patient why is really not a helpful uh, strategy when you're communicating. Why questions, uh, first of all, they can put the patient on the defensive, okay? Um, they make them feel like they need to justify their decisions, all right? So it makes them very defensive about that. They feel like you are challenging their decision-making skills, okay? So that's why questions are not really helpful. Also, why questions tend to be a little accusatory, okay? So we avoid why questions at all costs, all right? If you see a why question on your NCLEX, go ahead and eliminate that question, right? Take a look at number 4. Eliminate authoritative answers, okay? Remember, therapeutic communication is all about communicating the details of that patient's care to them and helping them to understand and therefore make educated decisions about their own care, okay? Um, Authoritative answers are kind of like giving advice. It sounds like giving advice a lot, but what it is it's telling somebody what they should do, and you're using your authority as a nurse or maybe someone's authority as a doctor or a healthcare provider to tell them what it is they need to do rather than give them options and help them to make that decision on their own. Okay. Anytime you see one of these questions, um, you can go ahead and eliminate the authoritative answers, okay? Let's look at number 5. 5, we want to eliminate focus on the nurse answers, okay? Remember, one of the key components of therapeutic communication is that this is patient-centered, okay? The focus is on the patient. Sometimes it also extends to their families. We do focus on them because we treat families as well as patients, right? But one thing that therapeutic communication never does, either on NCLEX or in the real world, is it never focuses on the nurse, okay? We're not the one being treated. We're not the person here that is being considered for care, okay? So anytime you see answers that focus in on the nurse and bring the attention back to the nurse, we can get rid of those answers, okay? And number 6, you could eliminate close-ended questions, all right? We talk about open-ended questions are a good part of therapeutic communication. Well, one of the bad things about therapeutic communication is close-ended questions. Close-ended questions just end in a yes or no answer. They don't divulge any additional information that could be helpful for either the patient or the nurse, okay? So we want to lead them to questions that are going to help them to describe more of their condition and more of their history and more of what their problem is to us. Okay, yes and no answers don't answer that well. A good example might be, have you taken your meds today? Well, that's a good question, but it's just a yes or no answer. That's a close-ended question. Another way to ask that question to make it open-ended would be, tell me about your medication schedule every day. Right? That opens up the question for the patient to describe to you in detail what their day is like, okay? All right. So those are 6 steps in therapeutic communication that you can use, all right? And like I said, once you go through these 6 steps, usually you've either eliminated it down to 2 options or you have your answer, okay? Hopefully the right one, probably the right one, okay? Remember that right answers, they will acknowledge the client's feelings, okay? Remember, acknowledgement gets you a long way both at the bedside and on NCLEX, all right? Here's a good example. You seem concerned that your relationship with your husband might change. You know, that will go a long way right there with patients. Number two, provide correct and relevant patient education. Okay. Good example there. You're experiencing acute alcohol withdrawal. You may see and feel things that aren't real. Okay. It's a great statement. It provides information. It doesn't judge the patient. It doesn't tell them what to do. It's not probing into their personal life and their usage. That's an excellent question there and that's the one we would really like there. Okay. So those are two qualities that the right answer will always have. Okay. Let's dig a little deeper, guys. All right. Let's practice this. Okay. So if we saw this answer choice, would we want to keep it or would we want to eliminate it? The nurse says, I'm so sorry for your loss. I can imagine that this time is really difficult for you. What do you guys think? If you'd like, you can pause this video and think about it and make an answer. All right. So if you've chosen your answer, let's continue, okay? Will we keep this or we would eliminate this option? I'm going to say keep it, guys, okay? Can you guys identify why we want to keep it? Well, this is a great example of an acknowledging question, okay? Or an acknowledging statement, excuse me. All right. The nurse is being empathetic and compassionate with this patient, okay? And they're just acknowledging that this is a really difficult time for them, okay? Remember, acknowledging goes a long way in NCLEX and the real world. So if this was one of our options, our possible answers on an exam, we would want to keep this option, okay? If you got that right, good job. Let's take a look at another one, guys. If we saw this answer choice, would you want to keep it or would you want to eliminate it? The nurse says, why did you miss your last 2 appointments? Think about it. We want to keep this one or do we want to let it go? Scratch it out. Go ahead. If you need to pause your video and think about it and come up with an answer, you can do that right now. Okay, what did you guys think? You want to keep this or eliminate it? This one we would want to eliminate, guys. Okay. Can you identify why? Well, remember, one of our steps is that we don't want to ask why questions, right? This is a why question right here. It's questioning the patient's actions. And when we question people like that, it puts them on the defensive. They feel a little judged. They feel like we are accusing them, okay? And it makes them defensive and it puts them on the lookout, okay? Why questions are not a good option. Okay, so that's why this one needs to be eliminated. If you got that right, excellent job. All right, let's take a look at another one. If we saw this answer choice, would we keep it or eliminate it? Doctor says, I think you should go on this diet as it will be better for your health. Right, take a minute to think about it. If you want, you can pause your video, think about it, answer the question, and then restart the video when you're ready to go. All right, guys, what did you think? This one we want to eliminate. If this was one of our answer choices, get rid of it. Why do you think? Okay. Can you identify why this option would not be a good one? Well, this is a really good example of an authoritative answer, okay? as the nurse, or in this case, the doctor, the surgeon, okay, is using their authority as a surgeon to tell the patient what they think they should do, okay? All right. It's telling them what to do. It's not letting them come to the decision on their own. And it's, like I said, it's using their authority as a healthcare provider to tell them what to do. Okay, so this is a authoritative answer here. And remember, that's one of our six steps that we don't want to use. Okay, we don't want to answer questions like this. To get rid of it. If you got that right, excellent job. All right, take a look. If we saw this answer choice, would we keep it or eliminate it? The nurse says, I can see that you are frightened about being here. I will sit quietly with you. All right. All right, take a look at it, guys. See what you think of this option. If you need to pause your video for a minute and think it through and get an answer, go ahead. You can pause it right now. All right, guys, let's take a look at this. If we got this option, would we want to keep it or would we want to eliminate it on our answer choices? This one you want to keep, guys. Can you identify why? Remember, acknowledging patients' feelings and their situation gets you a long way in NCLEX and at the bedside, okay? This is a great statement that is acknowledging that the patient's frightened, okay? And remember, we said before, become comfortable with silence. The nurse is willing to just sit quietly with them, okay? Sometimes when people are feeling alone and afraid and feeling very anxious, just having someone there with them, whether we say something or not, can be really helpful for them, okay? So that's why this is a great option, okay? It acknowledges those feelings. Good job. Let's take a look at another one. If we saw this answer choice, would we keep it or eliminate it? Did you have a good relationship with your mother? Okay. Think about that one, guys. Think about whether you'd want to keep this or eliminate it if it was on what test that you took. All right. If you need to pause your video and think about it and come up with an answer, go ahead. You can do that right now. All right, guys, welcome back. Let's take a look here. Okay. Are we keeping this or are we eliminating this? Did you have a good relationship with your mother? Eliminate this answer, guys. Okay. If you got this on a test, you get rid of it. Can you think why? All right. Well, the reason why is that this is a great example of a probing or an exploring question, okay? Is this question related to their healthcare that we're providing? I don't know. It seems a little personal, okay? Maybe this patient doesn't want to divulge that information about their mother. Maybe they had a bad relationship. It's something they don't want to talk about. It's really possible. So remember, we don't ever want to pry into people's personal lives and into their private details, okay? So this is a good example of an exploring question. And if this showed up on our exam, get rid of it, okay? All right, how about another one? If we saw this answer choice, would we keep it or eliminate it? The doctor says, there's no need to be scared. We will do everything we can to ensure you get good care. All right, think about that one, guys. You want to keep this or eliminate this? If you need some time, go ahead and pause your video Take a minute, answer the question, and then we'll come back and we'll talk about it. Okay. Okay, guys, let's take a look at this. Will we keep this or eliminate this? There is no need to be scared. We will do everything we can to ensure you get good care. If you saw this, guys, get rid of it, okay? Get rid of that option. Can you identify why? Well, this is the equivalent here. It's a good example of a don't worry answer, okay? Don't worry answers are not good because remember, they don't acknowledge people's feelings. They're the opposite of acknowledging. They're dismissive, okay? It's telling someone that they shouldn't feel the way that they feel. The truth of the matter is we don't exactly know how they feel, right? And so for us to tell them that they shouldn't worry isn't really helpful. Also, remember, don't worry options give false hope, all right? We don't exactly know what the outcome is going to be for each patient, okay? So it's really not right for us to give false hope or false assurance about how things are going to work out, right? So if you saw this on an exam, get rid of it, okay? How about this? If we saw this answer choice, would we keep it or eliminate it? I know from experience how hard this is for you. All right, guys, think about it for a minute. Think about if you'd keep this or eliminate this option. If you need to, you can pause your video, think about it and answer it, and then restart your video when you're ready, and we'll talk about it. All right, guys, let's take a look at this answer here. If we saw this, would we want to keep it or eliminate it? I know from experience how hard this is for you. Well, if you saw this, guys, on an exam, go ahead and get rid of it. Remember, one of our 6 steps is that we can get rid of answers that focus on the nurse, okay? This nurse is probably trying to empathize with the patient, but it doesn't come across that way, okay? What it comes across as is that the nurse is talking about themselves and they're putting the attention on themselves. And remember, all of our care should be patient-centered, okay? We focus on our patient. So if we saw this, we would want to get rid of it because this focuses on the nurse. Good job if you got that right. Okay, how about this? Would we keep it or would we eliminate it? I think we already saw this one actually. Why didn't you take your medications? You want to get rid of that, guys. Remember, why questions? They make people feel like you're questioning them and you're questioning their judgment, okay? And when they feel that way, they get on the defensive. They feel like you're accusing them and they get defensive about it, okay? That's not the way that um, we would want to communicate with them. Second thing to notice, this is actually a close-ended question too, remember? Why didn't you take your medications? It doesn't really provide a lot for these patients to answer with, okay? All right, so get rid of this option if you saw it. Here we go. Let's do another one. Would we keep it or eliminate it? You seem very upset. Tell me how you're feeling. All right, take a look at it, guys. If you need to pause your video, go ahead. Okay, guys, let's take a look at this. If this is an option on our exam, think about if you would keep it or eliminate it. You seem very upset. Tell me how you're feeling. Well, this is a great option. You would want to keep this, guys. Remember, it's acknowledging, and that gets you a long way on NCLEX and in real life, okay? And also, it's an open-ended question. Tell me how you're feeling. It leaves room for the patient to express what's going on with them and to share, in detail about how they're feeling, okay? It's not a yes or no answer, okay? Yes or no answers don't get us a lot of information. They also don't make the patient feel the relief from telling people how they feel, okay? That's two good reasons why we wouldn't want to keep this option, all right? Excellent job. Let's take a look at another one, guys. I hope you're getting good practice with this and that you're getting the hang of it. Let's figure out if we want to keep it or eliminate it. Can you tell me the real reason you injured yourself? All right. Take a moment to think about it and come up with an answer. Remember, go through those 6 steps. All right. And if you need to pause your video, go ahead and do that. And you can restart the video when you're ready to discuss it. All right, guys, welcome back. Let's take a look at this. All right, so the nurse says, "Can you tell me the real reason you injured yourself?" Would we want to keep it or would we want to eliminate it? Well, this is not a great option, right? Because this patient is going to feel like the nurse is basically saying they don't believe the patient, okay? By asking, they're saying, "I don't believe how you injured yourself. Tell me the real reason," okay? I think that would make all of us kind of a little upset and a little like offended, right? If someone insinuated that we were lying about something, okay? The truth is, sometimes patients do lie, but we don't know that, okay? So it's not right for us to make that judgment, okay? This is going to put your patient on the defensive, all right? It's going to make them feel like you are accusing them, okay? So this one you want to get rid of. All right, excellent job. All right, so now we've talked the talk, guys. We've gotten a little bit of practice with this. We are going to walk the walk, all right? We're going to do some practice questions here, all right? A client newly diagnosed with schizophrenia is brought to the hospital by his identical twin for the first follow-up visit post-discharge. The twin says to the nurse, "I read that schizophrenia runs in families. I guess I'm doomed." What is the best response by the nurse? All right, you can go ahead and pause your video right now. Use your 6 steps. Try to eliminate wrong answers. Choose an answer that you think that is correct, okay? And when we come back, we're going to discuss it. All right, guys, welcome back. Let's take a look at practice question number 1, okay? So a client newly diagnosed with schizophrenia is brought to the hospital by his identical twin for the first follow-up visit post-discharge. The twin says to the nurse, "I read that schizophrenia runs in families. I guess I'm doomed." What is the best response by the nurse? Okay. Number 1, right now I would worry more about how your sibling is doing. Number 2, the odds are about 50-50 that you will get the disease as well. Number 3, would you like to talk to a healthcare provider about this? Number 4, you are at risk for the disease. However, there are other factors that contribute to developing schizophrenia. We can get rid of number 1, guys. All right. It's dismissive of our family members' feelings, okay? And it doesn't really answer their question. But number 2, We can get rid of number 2 as well. Remember, we want our patient teaching to be accurate. Telling someone this 50-50 that you get this is not incredibly accurate, as it doesn't take into account all the other information about schizophrenia, okay? How about number 3? Would you like to talk to a healthcare provider about this? That seems helpful, doesn't it? But you want to get rid of number 3. Number 3 does not answer the question, okay, that the family member is asking. And it essentially pushes work onto other healthcare providers, right? Instead of doing the teaching yourself and explaining yourself, it's passing it on to somebody else to do the work, okay? That leaves us with number 4. Why is number 4 a great option? Let's take a look. You are at risk for the disease. However, there are other factors that contribute to developing schizophrenia. Well, this is a great option, guys, because 1, it answers the question, okay? 2, it's true. It's correct information, right? That family member is at risk for developing schizophrenia, okay? But that there are more factors that go into whether someone is schizophrenic or not than just genetics. So that's a true statement, okay? So number 4 is your correct answer. Good job with that. I hope that you got that as well. All right, let's keep moving. Practice question number 2. The client had surgery for possible cancer. The positive biopsy result is back in the medical record, but the client has not been told the biopsy showed malignancy. The client asks the nurse, "Am I going to die?" What is the best way for the nurse to initially handle the situation? Go ahead and pause your video right now. Use your testing strategies and eliminate some wrong answers here. See if you can choose which is the right answer, okay? And when you're ready, go ahead and start your video again, and we'll discuss why. All right, guys, welcome back. Hopefully you're able to narrow it down to a couple options. Maybe even you have the right answer now. Let's take a look. The client had surgery for possible cancer. The positive biopsy result is back in the medical record, but the client has not been told that the biopsy showed malignancy. The client asks the nurse, "Am I going to die?" What is the best way for the nurse to initially handle the situation? How about number 1? Everyone will die one day, but good treatment is available for most cancers today. Well, number 1, we can get rid of number 1, right? It's not particularly helpful at that moment to point out that everyone's going to die, okay? There are lots of treatments for cancer, correct? But again, this offers some false reassurance to this client, okay? Telling them that, basically we have good treatments, so you don't need to worry, isn't not very helpful at the moment, okay? How about number 2? I can understand your anxiety about the situation. Let me call your health provider. There's 2 reasons this isn't a great option. Number 1, the first part of the sentence, I can understand your anxiety about the situation. It's not really acknowledging, isn't it? Is it? It's more focusing on the nurse. And that's never a good thing to do. And second of all, it doesn't, on the second part of the answer, let me call your healthcare provider. It doesn't really answer the question, okay? And it passes on the task to somebody else to do, okay? So number 2, we can get rid of that as well. How about number 3? Share with me your thoughts and feelings about the situation. That sounds really good, right? That's open-ended. It gives the client the space to talk about what's going on with them, right? Let's keep this, okay? And let's take a look at number 4. The biopsy results came back as malignant, but that doesn't mean the cancer is not treatable. Well, whose responsibility is it to share results with patients. It's not the nurse, is it? It's actually the healthcare provider, right? Why is that? Because the healthcare provider is, patients are going to have questions when they get results from biopsies and diagnostics and labs, okay? And the most qualified person to answer those questions is the healthcare provider, okay? Nurses, it's not within our scope of practice to interpret and to answer questions about diagnostic results, okay? So this isn't a great option either. That leaves us with number 3, okay? We kind of thought that was the best option, didn't we? Share with me your thoughts and feelings about the situation. It's an open-ended question, all right? It's acknowledging the patient's fear of dying, okay? And it gives the patient space to talk about what's going on with them, okay? It's an excellent response, okay? I hope that's what you got, guys. Let's keep moving, okay? Practice question number 3. A client who is diagnosed with breast cancer asks the nurse, "Am I going to die?" Which statement by the nurse is indicative of a therapeutic relationship? Okay, it's a similar question, guys. Go ahead and apply your testing strategies, your 6 steps there of therapeutic communication. See if you can eliminate options and either get it down to 1 or to 2 options, or maybe even get the answer the question, okay? Go ahead and pause your video right now. And when you're ready with an answer, come back to the video and we'll discuss it, okay? All right, guys, welcome back. I hope you had a good time with answering that question. Let's take a look, okay, and go over the answers. A client who is diagnosed with breast cancer asks the nurse, "Am I going to die?" Which statement by the nurse is indicative of a therapeutic relationship, okay? Number 1, cancer is no longer a death sentence. You could live for many years yet. Well, it's not a great option, guys. Why is it not great? Okay. This is the equivalent of a don't worry answer, right? You're telling the patient not to worry that they have cancer and that they could live for many years yet. It seems encouraging, okay, but it's actually it's telling them not to worry. It's dismissive of what they're saying and what they're feeling, okay? So number 1 is not a great option. Get rid of it. How about number 2? I will get the chaplain to come and talk with you sometime. If you get number 2 on there, remember, this is passing the buck on to another healthcare provider. It's passing on the work to them. You're not answering the client's question, and you're passing the question on to another healthcare provider to answer. Okay. If you get this option, get rid of it. Okay. How about number 3? People with cancer frequently experience fear of dying. Tell me about your concerns. That seems like a great option. Let's keep it. Okay. It's great because it acknowledges what this patient is feeling. It also gives them accurate information about cancer patients and their fear of dying. That's true. And it's an open-ended question, okay? It's not a yes or no answer, and it leaves open a lot of space for the client to talk about what it is they want to talk about, okay? It's a good option. Let's keep it. Let's take a look about number 4. Tell me about your life and your hopes for the future. That sounds really nice, doesn't it? That seems kind of kind and kind of very empathetic, but it's kind of dismissive of the patient's feelings. They just asked you if they were going to die, and your response is to ignore that question and to divert the attention towards their life and what they're planning for the future. It's a great question, maybe in another situation, but for this particular situation, it's a little dismissive of what they're feeling, okay? So we can get rid of number 4. We're left with number three, okay? People with cancer frequently experience fear of dying. Tell me about your concerns. As we said, this acknowledges their feelings, okay? It's also open-ended, okay? And it gives the patient opportunities to talk about what's going on with them, all right? So excellent job if you chose number three. You're probably getting the hang of this now. All right, let's take a look at practice question number four. The nurse is providing teaching to a client prior to discharge. When the client breaks down crying, saying that the doctor thinks she is crazy because he diagnosed her with a functional disorder, which statement would be the best reply to this client? Okay, go ahead, guys, take a look at your options, read through each one, apply your testing strategies, okay? Use your 6 steps, all right? And go ahead and pause your video while you do that. And when you've gone through them and answered them, you can start your video back up and we'll discuss the answers, okay? Okay, guys, welcome back. Let's take a look at this question. It's a good one, all right? Hopefully you've been able to narrow it down by now, or maybe you even got the right answer, okay? The nurse is providing teaching to a client prior to discharge. When the client breaks down crying, saying that the doctor thinks she is crazy because he diagnosed her with a functional disorder, which statement would be the best reply to this client? Number one, functional disorder is a general diagnosis for a genuine medical issue that medical science does not fully understand. That's correct. That's factually correct there. You're answering the patient's concern and you're giving them correct information. That's a good option. Let's keep it for now, okay? Let's take a look at number two. I'm very sorry to hear this, but are you sure that's what he meant? It seems good at first, right? But number two is not a great option. Why? Because you're questioning the patient's competence, right? You're asking them if they really understood why the doctor said that, or if he even said that at all. You're kind of discrediting them, okay? You're dismissing their concerns. Not a great option, okay? We can get rid of number two if it was in our exam, okay? How about number three? The doctor does not know what he's talking about. I'll give you the information my healthcare provider used. I think we can all see the problem with this option, right? Remember, we don't ever want to discredit other medical workers. We wouldn't like it if someone did that to us. We can't do that to our other medical workers, okay? Um, Giving this information that that nurse's healthcare provider gave them is probably it may not be appropriate either. We don't know their situation. We don't know the details of their situation, okay? It may not be an appropriate treatment, okay? So it's not a great option for a number of reasons, okay? You see this on your test, don't choose it, all right? Get rid of number three. And how about number four? Why do you think he said that? Well, okay. It kind of seems like an open-ended question. Maybe the nurse is trying to find out more. But remember, why questions aren't great options, okay? The patient feels like you're interrogating them a little bit, like you don't believe them, okay? And why questions put patients on the offensive, okay? On the defensive, excuse me. So asking them why he said that is not a great option. So that leaves us with number one, all right? This is a great option because it gives them correct, accurate information, okay? And it answers the concern that the patient's talking about, right? If you got that correct, then you're probably getting the hang of this. Good job. All right, let's take a look at practice question number five. A client with a diagnosis of antisocial personality disorder was given a 2-hour pass to leave the hospital. The client returned to the unit 15 minutes past curfew and did not sign in. The next day, this behavior was brought up in a group meeting. The client says, "It's all the nurse's fault. The nurse was right there and did not remind me to sign in." What is the best response by the nurse? This is an interesting question, huh? Okay, take a minute or two to look through your options and read them. Apply your testing strategies, okay? See if you can narrow it down to two options. Maybe you can even get the right answer, okay? Pause your video right now while you do that, and you can start your video when you're ready, and we'll go through the answers, okay? All right, guys, welcome back. Let's take a look at this question. It's an interesting one, isn't it? A client with a diagnosis of antisocial personality disorder was given a 2-hour pass to leave the hospital. The client returned to the unit 15 minutes past curfew and did not sign in. The next day, this behavior is brought up in a group meeting. The client says, "It's all the nurse's fault. The nurse was right there and did not remind me to sign in." What is the best response by the nurse? Let's take a look, guys. Number one, "I'm sorry, I should have reminded you to sign in." Is that a good option or is that a bad option? Keep it or eliminate it. Well, if you get this, we can eliminate this one. Why? Because whose responsibility is it to come back on time, and whose responsibility is it to sign in and out when they leave the unit? It's the patient's responsibility, right? It's not actually the nurse's responsibility. So this response by the nurse saying, "I'm sorry, I should have reminded you to sign in," the nurse is accepting responsibility that is not correct, okay? They're taking on the responsibility of the patient, and that's not correct. How about number two? "It's not my fault that you forgot to sign in." Well, the nurse is correct. It's not their responsibility for the patient to sign in, but this is a little accusatory, isn't it? It's a little defensive, all right? It's placing the blame, and that's not great language. Okay. This kind of answer is probably going to start an argument with that client, okay? You can get rid of number two. Number three, "It is your responsibility to sign in when you return from a pass." Okay, this is actually a great option. Why so? It's correct. It's factually correct, okay? It points out where the responsibility lies, okay? It lies with the patient, not the nurse, okay? And it's pretty polite and it's pretty professional, isn't it? Not accusing anyone or anything or starting a fight, all right? You're clearly communicating with this patient that it is their responsibility to sign in when they come back from a pass, okay? Let's keep that one for right now. How about number four? The nurse says, "You were late coming back from your pass. Is that why you didn't sign in?" Well, I think we can see the problem with this one, right, guys? This is accusatory, okay? You're accusing the patient of purposely not signing in to the log because they were late. It's not a great way to start a conversation. Again, this option is probably going to start an argument with the patient and the nurse. All right? We can get rid of number four. So we're left with number three. Remember, we like number three because it's clear, it's polite and professional, okay? And also, it reminds the patient where the responsibility lies, okay? The nurse isn't accepting responsibility for the patient. She's reminding the patient that it's their responsibility to sign in, okay? This is a great example of assertive communication right here, okay? You chose number three, great job. That was a little bit of more of a tricky one, wasn't it? All right. That is it, guys. So that concludes our webinar on therapeutic communication. We got a lot of really good practice during this webinar, okay? And I hope that right now you've gotten a good taste and you understand a little bit more how to spot some of the examples of those 6 steps that we went through. Okay. Remember, when you get therapeutic communications, work through those steps, okay? And usually by the time you get to the 6th step, all right, you've either narrowed it down to 2 or maybe you have your answer already. That's a good thing, all right? Um, Remember, acknowledging gets you a really long way with therapeutic communication, both on the test and at the hospital. Ask open-ended questions, okay? All those are good tips. And remember, next time you get this question on an exam, you don't need to be nervous because now you know how to, you have a testing strategy to answer therapeutic communication questions, okay? All right. Thank you so much for watching this webinar. I hope it was helpful to you and I really enjoyed presenting it. So good luck with your therapeutic communication questions and we'll see you next time.